software. So this is your application, okay, Mediforte, and the username password I think you have already in the software. Let me give access this one, Mediforte@123. Okay, this is, you can change the username and password. As of now, before first of all, I am going to admin login. Okay, so in admin login we can able to create a user and their role defined and activity control. So I gave Mediforte username password, and just we click on submit. Okay, so it will allow you to administrative control access, where you can have your username password creation for various kind of user, like receptionist, pathologist, nursing, doctor, pharmacist, etc. So I am creating some few user to help you how the system will work. So here you can see this icon to user icon plus, we click here, and here we will define the user type. So let me go to Mediforte hospital. Okay, this is the name of hospital we can put here before. After the username, for example, just for example I am using doctor a user, or before it we can create a reception. Okay, here we can put specific person name also, or I am using for demonstration username RECEPTIO reception, password also RECEPTIO reception. Okay, and mail ID, like we can put RECEPTIO reception @mediforte.com. Okay, for example, here we can put mobile number 123456, the user's mobile number for which we are creating username account. Okay, we can put here some password also, and how much duration we are going to define this user permission. Here the address of user, like Lusaka, Zambia, right? Sorry, I think you are this is in the Kishi. What pronunciate this, am I right or something wrong? What is the city name, what you pronunciate this name? Kisi, correct. Okay. So this is the ID proof of user, and here you have able to select the type of user, either it is billing user, nurse, or pathologist, or pharmacy line. So I select user type reception. So according to the respective module which we have to provide this reception user, this module automatically selected by software. If you want to allow additional module, you can click on the like reprint option to be given. Okay, OP billing services for the patient we can give like that, and even if we need to give, if we don't give any billing module, so we can revoke here billing services, only just registration and reporting and daycare facilities can be given, and appointment facility also can be given. Okay, this is the part of that, and here add master and view master not to required, so we can define here hospital services pricing definition they can put here. Okay, and here billing service, what kind of the billing service, this is add, edit, delete service for the billing part. Okay, so we go to select here adding service, but we don't give edit or delete provision, so that's why they will not able to make here, and all departments local can be created, and there is the insurance company listing permission can be given. So this is the selective module and permission given, and if you want to allow any user permission, edit or like that, so you can give him admin. If don't want to allow edit, delete, so don't give him admin or super admin access, so they will not able to update anything apart from this administrative control. Okay, after doing so, we will click on the submit button. This type of the user will be created. Okay, the reception user have been created. Okay, similarly let me create a user for a doctor. Okay, exactly. So what we do, Correct. What we will do, every user with the role based access, ID password access, you can generate yourself also. Either you can we can help you to define this thing also. Okay, so I am just making a sample training process how the system is working for you, so you can have a comprehensive idea about different very module and functionality, right? Here the user's ID proof type, like take 1 2 3 4 5 or whatever user like the ID proof means if the user who is working in our hospital as a receptionist pathologist, we can collect their respective ID like driving license, passport, visa, national tax ID as a evidence that the user is not fake. We have proper information. Okay, and we can select the type of user, it is a doctor. So the respective module which we have to provide the doctors will be auto selected by software. If we need to revoke some doctor access, so discharge summary, certification, permission, okay, appointment, like that, so e-prescription, okay, IP doctor notes, so you can give ICU emergency also. Okay, and they can see the report nursing desk, but nursing desk will give to the nurse side, not to the doctor side. Okay, so we can select here laboratory, radiology, provision, department based on doctor access permissions, so they can see their respective patient also. And there is no any billing required, so we don't allow add billing, edit billing, delete services, and like that. And here master data only prescription definition, so we will select able to e-prescription definition, and we are giving e-prescription control module also to master module creation. So that is we have defined a doctor type of user. So I have created one reception, one doctor. Now we will create laboratory, radiology, pharmacy. 3 different user will create and will see the system. Okay, now Mediforte hospital, okay, and here the ID proof or something like that we can use like visa card for example. Okay, and there the type of user is a laboratory lab technician. Okay, so he will able to prepare the lab result, he will not able to prepare if you want to allow a laboratory administrative power, so you can give pathology services, so he will able to create lab and master activities and reprint option, so he can regenerate the report if anything, and laboratory all option we can give them for this purpose. And all doctors report they can able to prepare, so we can allow doctor department and like that, and ward, and in the master section if we go laboratory services, so we will allow him to prepare laboratory master services also. Okay, so we will give him laboratory permissions and control for this user. Okay, and here panel services for the user. So I created this as a laboratory user. Okay, now we will do one for pharmacy, one for radiology. So we go to here Mediforte hospitals. Okay, here I create another user, radiology, password and also. So okay, Here same we can refer the user ID is the password for user, and this is the validity duration for how many times you want to allow this user access control for this user. And here the user is the radiology, so we selected radiology user. Okay, so according to here username and password, these are here. Yes. Okay, so I created radiology user with the master and radiology module permission, and we can also give reprint provision if needed. Reprint means a duplicate printing for the report if once could not able to regenerate. So, and here as it is the user is radiologist, so we do not give any laboratory access, only radiology module given, and or department doctor permission. If you select any specific department and user type, so he will do only the respective services. Okay, so here we and the master we are also giving radiology window, and under the panel what panel we like to give, so we selecting the according required information for this radiology type user. Okay, so this was a radiology user. Now finally I create one more user, that is called a pharmacy user. So we go to Mediforte hospitals pharmacy. Okay, I am putting username and password also the same pharmacy to easily understanding. After later on you can change them also if needed, and you can create multiple format, and either you can enable disable them. Okay, with the respective user and give username, password and something. Here we can use the type of user, either that it is the pharmacy user, so we select a pharmacy type. According to the system, we'll select a medical sales and pharmacy module only, and the repeat option. And as it is the user is not laboratory radiology, we need not to select them, only the doctor's permission you can given, a referral activity can be given to them. Okay, apart from that the ward bed facilities and into the medical, so as it is we can select a medical master package definition to this user, and master services we can define this part of user. Giving drugs, yes, drug medicine also. Yes. So we giving yes, definitely we will also create the account user. So as it this user is the billing user, so we can select here medical services for billing part, medical advance and medical billing, and here we select medical advance and medicine billing part. Okay, and delete service will be for the administrator, so we will not give him delete permission also, and just we save, and the pharmacy user will be created. Okay, now as you requested for account user, we can able to create a like Mediforte hospitals, and you need to one account user, right? So we select here account module. Here we can put him as a account user. I think Mr. Munes is account user, right? So okay, so we can change it later, no problem. I am just putting demo name with the account user, and I am putting here okay, and this is the user provision, what ID proof need to be required, and here that is the user is account, so we give him account activity accountant. Okay, and if we need to accessible permission to be required, giving him what model to be allowed for the account user, so we can give him as a admin permission, and they can able to see the billing record for OP and IP billing record. Okay, as well as patient MRD can be accessed. Admin means they can able to see multiple users financial report also. If we don't give admin permission, the account user will not see the multiple users report at a time. That is the limitation. So we have like this way user experience level, so we give them admin permission, not the super admin. Okay. And expenditure finance report, MIS report can be given to accessible for this user, and these are the required information we give you. And all doctors report, referral report, MRD report for financial transaction ward wise they can see, and no master module to be required to them, and just we selected them. If we need to backup restore facility to be allowed to this user, so we can give them also, they can maintain backup. Record register can given, and the all company listing like this way, and just we submit. Okay. So this was a 6 kind of the user I have created with the respect to login ID password. Let me write for you. User types, demo user type. Okay. I will copy the ID password for you. One is the reception. Okay. One is the doctors. I will send you the notes which I am writing for you what we are doing. Okay. So after presentation you will helpful for what we have done the work today's presentation. So this V6 type of user we created. Okay. Now let them log in with the respective account and see what modules are reflect under that user. Okay. So I will go to the login screen of the software. We'll come back here, and here this is the main software front end and login screen. If I use here reception ID as we created, and we'll check. So I user login, click on the user, so you can see what reception user will have the provision. Okay. So he will have the option for appointment creating for any patient. He will able to create a patient's appointment and collecting doctor and something like that, and he can select the doctor. Yes, correct. Appointment is the for future reservation for the patient to be visited in the hospital, and the registration is the walk-in patient entry who are coming here for the hospital. Okay. So here we can select the rate field, or it is OPD entry, IPD entry, so like that we can select the patient type. We can put the patient demo patient entry like demo patient demo patient. Okay. Patient. Yes, if we need to mention. Okay. So first of all, let me I complete this task master that I created, user control, and this is task have been I have created for you. So I putting them. Now we need to create a user consultation master. So let me check where you able to create a doctor or master like this or not. So I go to the Mediforte at that 1 2 3. Yes. So this user have option. Yeah, we will change it in the next event. I go to user login, and just we have all the module. Okay. If the user self they want to change their respective ID password, they click on their username. Okay. here they can able to change their own ID password. That recently, like for example, this is the administrator. Okay, so I create this username password administrator, and I create change the ID password also. This is username is like this one, so I could click on admin. Okay, at the rate 123, and password also admin at the rate 123. Okay, if we yeah, currently I put the same password. Do I change? Okay, you can change it later once you need it. Sorry, the old password required. So here the new password is like admin and then 123, right? So doing so, the user will able to change the data record, and the software will be once logged out. And now we have to log in with the updated ID password. That was we mentioned admin at the rate 123. So admin at the rate 123, password also admin at the rate 123, and just we log in with the updated ID password. No, it is simple Mediforte here. So let me check it. Administrator, admin control. Okay, so it has all permission, and it has user type is the administrator. Okay. So now we come back here to log in with the respective ID password that we have defined here, and just we click on admin. So now we have logged in successfully with the administrative account. Okay, now as you described me, you want to create some insurance company listing, so we go to the master window. Okay, here in the number 15 you will able to create various insurance companies name and type of like that, and what is the default payment method of the respective insurance company. For example, let me create a insurance company. Can you tell me any name of the company that you like to mention? CIC. Okay, okay. If any also TPA company name having, or we can use the same name also if don't have any respective TPA stands for third party insurance assistant, who help the hospital and insurance company to document verification and claim reimbursement complete procedure. Some Indian company have the TPA facility, insurance company. Yes. You can ask with the Dr. Sunil. He will explain TPA and insurance company difference, because TPA is third party assistant who will provide us a verification method and claim reimbursement process and approval and status and like this. So this are maintained by the like some have like for example Raksha TPA in India. It is a supporting company or to provide facility to CIC insurance company to verification of patient insurance facility. Okay, and here the tax ID, for example I put here AFP12 some tax ID number for insurance companies which are collaborated with our hospital, and here the contact number of insurance company customer care number like. Yes, Yes. So we can change your respective countries what is used for the respective insurance company's tax ID number. Okay. Yeah. Here, if we would like to give a card limit like 5 lakh rupees transaction, hospital treatment facilities allow like this, so it is upper limit we can mention. Here, the hospital's representative name who will help the patient in case of any clarification, assistant, technical require about this insurance facility to the patient. Okay, and we can put like no, it will not appear on the report. It will be for our internal record like that. Okay, it means your hospital internal record, like the CIC Insurance Limited companies where proper information which staff will give to the patient. Okay, so in hospital there are many of insurance company, so their supporting assistant will be there available in the hospital who give them the technical guide. For example, I can put here in the Munesh Kumar. So Munish Kumar can advise any patient how the insurance company will give the claim, what is the beneficial and card limit, and here username and password for insurance company accessible portal to their patient list like that. Okay. So I put a company ID password also. So if the software is online, that the CIC insurance company can able to access their own patient list which is covering under this insurance company patient treatment. Okay. So this username password you can create and give this insurance company's executive if they want to validate or verify their insurance company patient list and their treatment and their bill record. They can access via coming on the our software platform. They do not need to ask again and again will entry for from your side, so they will able to give the patient portal. I will show how it will work. Okay, so I put as a CIC ID password for the insurance company. Okay, now I submit. This insurance company name have been added into the account master. Okay, do you getting me? Hello. One second, let me start. Yeah, sorry my friend, the session was over. I have restarted it again. It was the time up. So 30-minute time was over, that's why I disconnected. I have restarted the same session. Okay, fine. So let me continue with the session. As we have mentioned the insurance company, sorry. Hmm. Yes, this is a tariff master configuration part of the software for respective insurance company basis. So I will also do in the next session how we can do. First, I am focusing on the case patient flow, insurance company wise tariff master. Okay, so that will be the part also of the software. Okay, I will guide you that in the next event. So currently I have done created a insurance company, and the now we one more thing you have to keep in mind when you are going to allow any user company one second insurance. So the insurance company also need to be assigned to the respective user so he can able to allow patient billing services or so that you created one more insurance company, so you can add here that company name also. Okay, need to be updated. Without updated, that respective user cannot able to mention the services which they want to update. Correct. Currently, this is provision. If you don't want to allow this event to be controlled, so we can revoke from master. Any insurance company you create automatically allow to every user. Okay. So this we can do here. Okay. Yeah. So now, shall I create an insurance patient name here? I will create a patient under CIC insurance company if you need. Or before it, I will go one more thing. Let me miss do one thing. We have created a master record for user access. Now I want to make doctor master and consultation fee master. So let me create a doctor with this Dr. Sunil. Okay, so we go for home screen. Okay, we will create here doctors or staff name. Okay, and what is the specialization of Dr. Sunil? General physician. Okay, so we go to here and I should write here Dr. Sunil. What is the surname should I put here? And my degree is the general. Do you know his degree like MBBS, MD, or sir, what is the degree they write in with the prefix, postfix after name? Okay, I put here his name and along with in the mobile number to post, I should mention this mobile number. 1 second, that we have in the record. And we put here this mobile. Here this is the valid consultation means once the patient have been registered, how much days the valid consultation will be available. For example, it's a 3 day, so once the patient have been seen, 3 days validity will be allowed. Here OPD chamber like OPD 001, the cabin number where he is sitting, doctor sign location. Okay, here any date of birth or salary date, or it's a mean the duration once patient's first consultation have been paid, so how much duration this will be covered. For example, if your patient pay 500 rupees, okay, and this is 3 day valid means if patient come within 3 days, no consultation fee will be applied. After 3 days, the yes like this one. And here the respective doctor's mail ID like sunil.l. at the so this way this doctor's number, RMC, or the registration number we can put here. Local address, permanent address, bank detail if you need to mention. The red fields are mandatory, rest fields are optional. Okay, so the red field, if any place is red mark, okay, highlight like this degree, email ID, it's a compulsory field, need to be mentioned. Okay, rest are optional, so we submit, and that's why you can created a doctor. Now if any doctor you created, you also have to prepare their consultation master. So if I go to view consultation doctor, and you can see doctor fees is yes means the doctor consultation has been defined here. It's we recently created Dr. Sunil Lamba, but we did not mention his consultation, so it is coming no. If you want to create, just click on this icon, and the consultation fee you can create here. How much fees to be applied? 200 fee, OPD fees or local insurance or like this way. Insurance companies fees like 250, international insurance like 500. So different mode of way consultation fee you can define here. Okay. Okay, so I put here 3000. Okay, the standard price for insurance, your cash patient. If it is for insurance patient, 3500 for local insurance company. If it is patient for international insurance company, the 4500. Like this way we can define three different insurance tariff. Okay. Yes, that I will guide you. I will guide you in the next event. That's company basis insurance definition. Okay. I submit now. So the standard consultation fee have been defined for this patient. Okay. So emergency OPD. So this way the consultation and services you can define. Now the remaining things to be defined, ward or bed services. Okay, so this is done. Consultation services and referral master. It is a referral master means when you want to define a doctor referral who have signed for example Dr. Sunil's reference have any friend doctor like Dr. Ibrahim. Okay, it is a referral doctor name who will sending patient to your Mediforte hospital, and we need to define his incentive commission services. So we go here and like MD medicine, and it's a mobile number, the referral doctor's mobile number. It's a hospital name like Ram Hospital. Okay, and it's a GST tax ID something like that, and like and here this is the main part, the incentive service slab definition. For example, if any patient comes, so we want to give the doctor consultation services consultation service for 10% incentive, so we define here 10% value of the in services. For laboratory services, if we do lab services for the same patient, so we will give the 20% incentive. Under for X-ray sorry, yes. So for example, so X-ray we define in amount of $50 or something like that. And if we need to define surgical services, for example surgical package, so we give him 30% of the surgical facility. Okay, so this way you can create a incentive commission of the different services like USG test, sonography. We like to give in amount, so it's like $250 for each test, like this way, and we save 5. So multiple insurance incentive categories definition we can define here for referral part. Okay, if patient have billing in various category like pharmacy, inventory, so but we did not define incentive for that service, so that will not reflect here. Only the along insurance facilities incentive will be added. Okay. Yeah, it can be C, but it is the primary doctor who is have been allied with that, but any referral cross doctor consultation can be done. Yeah, it is just for the information purpose who was having connected with our internal hospital to that referral doctor, like that. Okay, now one thing doctor referral have been done, and now ward or bed configuration we will do. Let me check ward or bed configuration. So this is available in the setting window, in this window. Okay, we go here and let me create for example some ward, general ward, deluxe ward, ICU, like that. So yes, not in this part is comes in the setting window, not in the master. Okay, yeah, and it is for the like IPD patient services. The ward is like general male ward. Okay, and this yes, that will be also will guide you how you can do, like general female. Okay, so I created 2 ward, general male, general female, and like deluxe ward. Okay, IPD deluxe AC. Okay, one for the CIC company's patient separate. So like example also we can put here CIC deluxe AC. Okay, so this for ward category we have defined here. Now there you can able to create color coding option, like which color we have to define the ward, so we can configure the patient's identification, which ward basis the patient we can easily identify them. Okay, so this is a different color combination you can put here. It is just for the iconic view, not for any specific uses. Put a light color for you to easily identify. So this way we define here some color combination. And now let me go the setting window to define their tariff plan and bed quantity definition. So bed allocation. Okay, add one. After that we go to bed allocation. Bed allocation will allow you, for example, a general ward. So as you described me, that is comes like G 010 like that. Two. Yes, you can give me, I will mention them. Okay. Okay, 15 bedded. So let me put here like this way, 206 after that 01. Okay, and 206 to where total 16 bed na, so 16. Okay, so if I click here, so you can see here total 16 bed have been appearing. But I would like to suggest how you can define here. I put here like this way, 206 like this way, and let me check it's a bulk or not. Yes. Okay, okay, now this way we will define multiple bed like female ward. What is the number should I mention here? Okay, 209. And how many bed under that? Okay, 012 15 or 16. Okay, so I mentioned that 2 categories. Okay, male or female. Yes. If we have like deluxe, so for example deluxe, yes, private rooms. Yes, I will change. Yes, we can change it the name also, no problem. Okay, 2012 to 205 is the private room, correct? Okay, so let me put it this way, and you can see the general ward will have your 16 bed for male and female also, and deluxe room we have mentioned 4 rooms, right? And I submit them, and as you describe me, you want to change the deluxe ward name, so we can put here private room. Okay, instead of the, okay, this is the, that is also comes in private room. Okay, so first we decided some 2012 or 20, let me check it, what was the good configuration view ward. The private room we have mentioned 5, 201 to 205, correct? if we need okay, so let me go 301 to 3010 to add more under the private room. So we go to again setting window and we go to room allocation, the bed allocation, sorry, and here I select the private room, and here we will have more editing option like 301, sorry, add capacity. So we need to extend the add capacity, so we go to in the edit capacity, add bed. Okay, so here we go 3012 310. Okay, so 10 bedded we need to allow in the same category. We go here and the 10 bedded also will be added to the account here. Okay, now we see total capacity will come here, total 15 bed under the private room, right? Okay, if you want to, now we like to make the tariff plan for the respective beds also. Okay, so we go to settings window, and under the settings window we'll have option room or bed tariff. Okay, number 3rd, go here and select the ward for like male ward tariff. What is the male tariff like for IPD, and if it is cash or insurance company, so for example I want to mention for the default IPD patient, and it is mandatory, optional, mandatory. It means mandatory means the software will automatically do the billing for every 24-hour basis patient. Optional means the billing user will to update the bed tariff for the patient. So we should use mandatory, and here we can use like bed charges for like bed charge. Okay, for 1 day. What is the tariff for 1 day tariff? Okay, so I put here 10,000, and the nursing care charges. Okay, so these are the basis of daily basis or one time or like that. Okay, and I put here this is for the male. The 24-hour basis means when a patient is admitted for like 4 o'clock in afternoon, so the bed charges will be repeated after the next day 4 o'clock, not the 12 o'clock basis. Okay, if you mention daily basis, so daily basis means that will become in every date change basis price will be applied. Okay, and so if we need, if it is one time means it will be applied like admission fees. Patient will be admitted for 5 days, but admission fee will be taken one time for any cases, so we can took them one time also. Okay, so that was a little difference. I will make one more categories for clarify to you. So we go to bed one more entry for go to settings window, and I will mention now one more tariff plan for the ICU categories. Okay, sorry, private room. Okay, and I will select them as a mandatory, like one file for admission fee. Okay, so what is the price should be applied for admission fee one time? Okay, for example 100, and here it is as a private room, so we put here room charges instead of the bed charges. Okay, what is the tariff for 1 day room tariff? Now we mention nursing care charges. Okay, so how much will be the nursing care? Say 1500. it's a daily basis. Okay, and doctor visit charge. Okay, one day $500. Sorry, visit. Okay, no problem. So it is the case patient. So we are using case patient entry, not the insurance company. Okay, this is the panel type. We are putting case patient only. Okay. So we submit. This is the tariff plan, and room tariff we can define either 24-hour or daily basis as you wish. Do I select 24-hour basis, right? And we submit this function. So I have created two type of room tariff for you, and rest you should create. If anything come, you can ping me to understand. Okay, I will keep on for you. Okay. Now the bed tariff and ward configuration I have explained to you. Okay, guided. Now let me create some lab tariff and radiology tariff, how we can define them. Okay, so for that we go to the master module. Here under 8 number, it is allow for lab rate master. Okay, so you go here, add, you can create here test names also, lab cash price, local insurance rate price, like that. If you want to update existing laboratory test names price, so you can go to view test window, and then you will have all the test names price, and you can change directly. For example, if you want to mention lipid profile test price, so I will search here lipid profile, and I can change here like 1000. I want to update this price. Okay, and 1500 for international, like that. Now if I want to mention LFT test, so I can put here LFT like 2000. So you can change that pricing of the respective insurance company, local case, like that. Okay, either you can change all test according to your requirement. Okay, so there you will have option to change the tariff plan for all tests requested, and changing the test price from here. Component all tests are there. Okay, that was the laboratory test price updating option. Okay, and along with, if we like to change the radiology test prices, so you go to 11 number, and you will have to, you can create a new test for X-ray, CT scan, MRI, for which kind of the test is. If you want to change any existing test price, you go to view radiology test, and you can change the prices. For example, like 1300, it is 2100, so you can change the prices for any existing product. You can change also that, like a USG test. If I want to change the price for this test, and I put here like 5000 and 7000 and the 10,000, like this. So I can change the price directly also here. Okay, this way radiology, and laboratory tariff master you can change from the software, right? So that was done. Now the come for hospital tariff master, I will guide you. So let me go for hospital services. That's come in the 12 number ID, and along with the 14 number. I will explain between difference of them. Hospital item means the general services for the patient, like dressing, nebulization, ventilation, or all kind of the service item that you can able to mention here, and change the prices. Like airbed is like, say, yes, yeah, correct, all kind of the services there with the hospital services, like OT charges. You can go to the next pages to ICU. These are the manual basis tariff plan. You can add to patient. It will not automatically pick up the system. For oxygen charge like 600, like that, it will become in the patient account once you select the item. Okay, yeah, so you can change here. Now that was done for the hospital services, right? Okay, and insurance company definition I have also explained how we can done. Now let's go with the patient creating OPD and IPD. Okay, So before it I have added some panel and like that doctor, so I will allow to this user will go to the Mediforte ID and administrator and allow this last user with all additional doctors created, like that I created Dr. Sunil Lamba also, referral Dr. Ardo also, and we have created this ward and company, so I have added to this account them. Okay, now I go to again administrative ID and will check the flow of the software. Here user login, and let's create a patient and we'll check complete flow of the system. Okay, do I create OPD patient or IPD patient, which you like to do? Okay, perfect, I will do the same flow. Let's go to registration. I will create a patient's name under OPD services, and here we will put patient name like uh, Edward K. Kenny. CSC, we need to define Tariff plan and the further master properly to complete the CIC insurance. Okay, if you want to mention company, we can use your CIC, no problem. Okay, and here Aadhaar ID or insurance company ID we can put here, like the ID number options, and here patient's mobile number like 123456890. Okay, and we can put here address like, okay, so PISITC. Yes, it is icon will allow you to send a patient notification on WhatsApp. If this mobile number is existing on WhatsApp, the patient will get the notification on patient mobile number that your billing services, like for example I put your mobile number. Do I put your number? Yeah, tell me. Okay, 0716. No problem. One second. So what was 0716 then 7458. Okay. And here we can referral doctor, as I mentioned, like if we have referral doctor we can select and there the consultation charges, one time hospital charges have been added, and here patient's basic detail we are mentioning, like patient age, gender, mobile number, and which doctor we are going to select, like general physician. So we select general physician and Dr. Sunil will be available to we see the patient, so we selected Dr. Sunil Lamba. Okay, and yes, here as I described, in every screen the software will compulsory field are marked as a red color, rest are the optional, so you did not to fill everything. Okay, so I just mentioned the red color information like patient's name, age, gender. If in any case like any patient request kindly mention my attendant contact number, so you will have provision to mention the attendant name, relation, and his address and mobile number for first attendant, as well as the second attendant's name, mobile number, address, like that, and with the relation. It is the optional part. Okay, and the token number is auto. Yes, so if you, yes, so this type of the relation. Okay, in case you don't have any spouse, so I will add the from the backend, and you can also check this. If you want to add relation, you can go to the master and you can add your own kind of the tab. Let me show you. Master and patient relation, you can go here and SEOVSE, right? I go here and I will update this data available in here. Now In the next entry I will show how will come here, and I will sending the consultation fees 300 of the Dr. Sunil automatically fetched by software which have been mentioned in the master. Okay, after this is total bill is 3100. If patient don't have full amount in cash, so we can have multiple option. For example, cash he have paid like $1000, okay, 1000, and he paid UPI mobile payment like 1500, and some part payment he keep due or debit or credit card or any FT or like that other option. So we can select here multiple option, and just we click save and print. At this moment system will generate a patient's receipt, this, and the receipt we will design according to your given format. Okay, and one the yes, we will use the same format. Currently I have just standard format that is coming, that's why. Okay, so don't worry, the designing of the billing format will be done according to as discussed already, no problem. Okay, so that was the OPD prescription format, and this is for the patient's receipt of billing services. Okay, and this is at this moment yeah, it means when the system generate a receipt, it means system consider the patient's payment have been received. When I was selecting mode of payment, it was the mode. If you do not receive payment, you should select due pending. It means the patient didn't pay the amount. Okay, yeah. Okay. Okay, then patient go to this billing counter, right, to make the payment. Okay, so he will register at the billing counter as the patient, and the payment will be done. So he will get any printed document from the reception. Okay, once payment will done, then the receipt will be provided to him, right? Okay, I will make these changes for you according to cashier validation. Okay, so I will guide them to you. I have put it for you in my notes. So this was a registration. So if we will not give any patient printing document, we will save the record, and the patient will go to the OPD billing counter here, right? And here the patient billing user will select the patient, and he will collect the payment and will give the receipt from the patient, and this time at this event the payment will be marked as a received. Okay, so this will be, we will make some small changes and will deliver in the system for you. Yes, correct. At the reception we will not give a print option, they will make the entry only, and payment will be collected at billing counter, no problem. Okay, okay. Yes, we have both option. So we will do according to as we need to apply for your hospital. Okay, so after doing so, the patient can go to the doctor pre-doctor screening OPD. Yeah, so nurse will mention to his patient's vital. Under the token screen they can mention BP, pulse, respiratories, and primary examination like 100 by 60, and pulse rate 60 by minute, and respiratory like that, what is the weight of patient. Okay, so the primary examinations will be mentioned by the nurse, what is the complaint, like patient have fever. Okay, fever and chest pain like that, so they can pay how much days, like 2 to 5 days have been done, and side like right, so right to back side, so they can mention like this way. This complaint body part like chest and temperature, what is the body temperature in Fahrenheit we can mention. So this is pre OPD screening have been done. Now the patient nurse can send it to the doctor, so she click on the accept button. The OPD will be mark the doctor, patient go to the respective doctor cabin. Here the doctor will select the patient and he can see the vitals record which mentioned by nurse for the particular patient, what was done there and what is the complaint mentioned. Now here any clinical side mention like patient having complaint of fever and chest pains periodic and irregular like this. And along with advised to take rest and medication. Okay, liquid diet, okay. And what the services advised, like doctor advised to do nebulize for the patient, for example nebulization services prescribed, okay. And dressing services if needed to do something like oxygen or something, any additional so like wound dressing, okay. Along with if we advise investigation like CBC, okay. And lipid profile, okay. So the pathology test, LFT. So this way we can prescribing test here, radiology, X-ray test and USG test we can prescribe, okay. So this way we have done some investigation prescription service, okay. And I save the record of the patient, okay. And we just save record or save and print, and just the record will be saved. Either it needed to printable, this letter pad or OPD prescription will be also redesigned as per our hospital's format, okay, for your hospital format, right. So this was the OPD patient prescription done by patient by doctor, and after the patient shall go to the billing desk for payment. Yes, so we go to OPD billing window. Here the billing window, user will select the patient, and once we click on patient, all item or yes, anywhere you can click anywhere on the respective patient. For example, you have many patients in the software, okay. If you the bell icon is indicator, means this patient is any pending task to be done, or the so billing user easily identify which patient item I have to do perform, okay. Once I click on the patient, system will ask, do you want to sorry, you say something. Hello. Are you getting, friends, my screen? No problem. There was the time up, that's why it is auto disconnecting. I have resumed the link, okay. Juhi, kindly mute your mic, please. No, I didn't say to you. It was my team. So I have prescribed by the patient's services. Now the patient go to billing desk, and once we select the patient of the red icon patient, and system ask prescribe item service. It means the system asking, do you want to make the billing of same item services that doctor have prescribed, or you want to do other billing. Okay, if you click on OK, means the item will be loaded by software. If you click on cancel, the item will not loading, so you need to do billing manually. Okay, if we click on OK, so the item doctor have prescribed, this item automatically come nebulized dressing, CBC test, LFT, what we have prescribed, and total amount is coming here 11,158, and this amount is paying by cash or UPI, or like which mode mobile payment you can select of them, and just do the service 7 pin, the billing of payment receipt will be generated. After this event, the laboratory radiology will get notified of this item service and billing have been done, and the patient can take the laboratory radiology facility. Okay, yes, that was the next is if patient don't make payment until they will not get service under the laboratory radiology. Exactly. So after done the billing, here if we go in laboratory, yeah, if as Dr. Sunil advised, M-Pesa will be integrated with your software, and at this moment when you select here M-Pesa, the software will pop up a payment gateway window, and the user will get notified patient, and once patient will make the payment, a transaction ID will be reflected under the software here to get the patient billing completion automatically. Okay, that will be the same. Yeah, if we make we need at this billing event, the billing user will select a mode of payment, UPI or mobile Pesa. Okay, if we select this way, yes, at this event, let me show how it will come. At the registration, if you select a mode of payment like mobile UPI payment option, so this way a pop-up window comes like this amount to be paid amount, and if user will click on pay, this type of payment gateway integration will be reflected, and at this payment window like mobile number, if I mention like my mobile number, and this will be a QR code based is generated, and the payment gateway integration will request payment for the patient mobile payment option. Once the patient will pay the payment, a transaction ID will reflect in the software and come to the our software record. Okay, yes, that will be done a integration facility in the next stage once the system have been executed properly. Okay, yes, so this way the mobile payment integration will be done. For no, I need to be API for the same, so we can do it. Okay, now the patient due to laboratory moment, here do you see the in the receipt we done 3 item for laboratory and 2 item for radiology. So the 3 item apart the laboratory will reflect here with the bell icon. So the pathologist user guy will select the all test, and he will click on sample collection. At this moment, blood sample, urine sample volume will be generated, and barcode sticker will be created by software with containing the sample ID number, laboratory's tested ID, patient name, and the barcode generated will be coming by software. Okay, sorry, come that it is count a separate test wise sample ID. Okay, because the different machineries are used different barcoding and the sample ID, and according to the report will be generated. Like this test we need to generate in the different machine with the LFT test, and CBC will be generated different machine. So 2 sample we need to separate need to be run on the machine to get the result from the respective machine. And this, if we use bi-directional integration, the sample ID automatically processed into the lab machine, and the result will be automatically come in the laboratory machine to software. Need not to your manual interface will be required. Here once I selected the sample collection, you can see the color coding of the have been changed. It indicate you that if you see this bell icon, red means the request have received, okay, yellow means the sample have been collected, green means report have been generated, blue means report verified. Okay, so this is the growth, a progress will be show where the patient event have been done. So once I will check all test, if I mention lab result, click on the lab result button. At this moment the lab result will, if machine integration done, here the result will become automatically by software, need not to user interface. In case of manual, we can mention like 11.8, 12,500, some value high or low flex, system will intimate the technician this result is abnormal or like that, and somewhere formula calculation will be done. Okay, so we can do this way, the various report we can mention, and the report once we done, so the report will be saved, and we can verify the report also. One second, just I save test, the report will be saved, and this report will be available to patient's portal and email printable option. This will be redesigned according to your given format, and the report will be paginatedly format will be given to you. Okay, so like this way. Yes, we will send a patient once the verified report. This is just a preview of the report, because until we do not verify, report will not go to the patient mobile number. After doing so, this report, if you click on patient, you can see the test name have been changed from yellow to green. The report have been updated. If I need to verify them, yes, if I need to verify them, I will select all test and click on verify test by green button, and this is the pathologist window where the pathologist user will able to check the report are okay or something correction to be done. Like for example, this is the very wrong value, I need to mention 105, so the pathology can change the report value. If here need to be 60, so he have power to change them the result value, and just verify test, and the report signature will be added of the pathologist over the report in right bottom side also, and then the report will send it to the patient's mobile number on WhatsApp. Okay, so currently hope you are getting any messages from software, or I have to link your mobile number for your hospital mobile number, which have to be linked with our software to sending WhatsApp. Okay. So that was the report have been done. If I click, the report color have been changed the blue color, so it is progress bar showing to you, right? It was the part of the yes, correct. If you want to, if you like to send a patient's report on any other number of patient apart from, so you will have option to select WhatsApp report, and system which will ask which number you want to send the report. So for example, what is your mobile number? If I currently your WhatsApp API have not integrated, so number will not send the report. Once I integrate, then the report will send on the patient mobile number. Okay. Now then we go to radiology part. Here you can see the two test requests have been done, one sonography, one for X-ray, that billing have been done. Okay, so if I select this and I go to radiology part, here under the radiology you can have the template basis report option along with the browsing for X-ray, CT scan, image report to be integrated with the software. Like for example, I put any X-ray report option, And in the sonography, for example, I want to use a USG report template. Here if you can use multiple report sonography or PACS or dichrome integration will be work to get the USG report. And here you will have template option like full abdomen, IUD or male report, and you can change the template. Here content will be changed accordingly, so the doctor will have option. Yes, it is coming in the name. Yes, yes, they will have their own format, and they can put them in the master, and the drop down will become here with the respective test name, and they can select the report, and they can put here result value and generate the report. Even they that are editable also, like for size and is normal 240 or into 280 by 10. So this can also editable before submitting the report. Any value, kidney, gallbladder, pancreas or anything they want to make the changes under X-ray, CT scan, everything is available. Correct. You can change them anything from master and will come here according to the respective format. And we do. Now you can do it here also, no need to go in master. Okay, if you want to change anything, so it is editable content. Okay, if you don't want to mention this, like you can delete from here also, write anything. If you want to add anything comment for this particular patient, like this particular patient, yes, you can change here. But it will be saved to for this particular patient. If you want to change this content, you need to go in master and you need to reset the content. Yes. If you change here, it will be effective for this particular patient only. Yeah. After doing so, we click on save test. The report will be stored with the image and text report for the patient, and this will be printed over letterpad or image file. And this is the radiology report. If we mention two report for radiology, image plus text report, both have been stored. Now in case of patient report printable, if you need to give image report, so you click on the select image report and just image report will be open. Okay, with the image file it can be seen by doctor. If doctor want to see the text report, so doctor can select USG test and he can select a single text report, so he can see text report of the patient like this way. So this was the radiology part. Now the patients can go to the doctor cabin also to cross verify report, and doctor can select the patient and he can see the labor report and radiology icon. If I click here, the prescription will be reopened with the bell icon of the eye symbol. If doctor want to see the lipid profile report, he will click on eye symbol of lipid profile, and lipid profile report will be available to view the doctor. So this is the lipid profiles report is available at the doctor screen. If he doctor yes, we will give allow to not print, only view permission will be given. Okay. Yeah, so this way the result can be accessible for the patient. After, if doctor want to mention medication, so here they can mention in the same prescription what medicine they have to put, like the like paracetamol quantity that should be available in the pharmacy store. Like let me put here 5 days before meal and 5 days TDS. The dosage master have to be mentioned. I think pharmacy have to be prepared before we go to demonstration this part of the pharmacy. Okay. Master data, right. I will go guide you the pharmacy flow separately in the next event. And now if we like to make the same patient admission, Okay, so I am done with the OPD. Now go to IPD. So here, if you want to use the same patient UHID, you can use this UHID, either his mobile number, and the patient record will come. For example, let me check what is the mobile UHID. That is his UHID, and I will copy this one, and we go to registration page, and I put here record and will tap. The patient's record automatically reflect here. If you don't remember patient UHID, and I have name or any mobile number, I can search with that also. For example, patient given Edward name. Okay, so I search that. Oh, sorry. Okay. Now, if I search with the patient name, for example, Edward. Yes, yes. If you want to search with the ID number, you go to here 2025. Sorry, here. Yes, national ID number also can be used, which we have taken at the time of registration. Okay. Here, if you mention any health ID or TID number, that can be also searchable option with the mobile number, royalty card number. That are the searching criteria. Okay. Now the patient is reflect here. If I click on the patient, the record will be automatically fetching in the respective field, and here we can make the IPD admission and which ward or bed we like to select. So we can have option like general male ward, and we can select the bed number, which bed we need to select it. So this you can see the bed number, like for example 2 number bed. Okay, and here the region like operation, and what is the surgery or procedure, like the surgery procedure we have advised for ortho surgery or something like that. So in the time of admission, these are the compulsory, and at the time of admission, if you like to select any part advance payment to be collected, for example 5,000 or 20,000 to be collected, so we can put here, and here we can select mode of payments like debit, credit card or something, UPI option, and do the transaction services, and then submit transaction ID automatically comes here, and we submit 7 pin. So IP admission will be started for the patient. So that at this moment a one patient ID card will be generated. It will be designed according to your requirement. One is the patient advance receipt payment service will be generated. One for IP consent form, patient admission consent form, or with the regional language can be generated. Yes, procedure consider. Okay, so that was a admission entry level. Now we will follow the daily basis operational window and IPD doctor's notes. So we go to IPD doctor notes. Here we can select the patient name, and doctor can write his patient remark for admission. Patient is critical, like that, and advised to ventilator services with oxygen. So like that, and nurse will put their remark event like that, and here the doctor requested for some services for to the patient, like lab test to be done, like blood sugar test. Sugar test have been advised by doctor, and something like HIV test prescription, and along with the COVID-19 something. So some IP test prescription can be advised by the patient, blood group, and X-ray or MRI, something like that, MRI services. So this was the IP services we are giving to the patient. Okay, and we can generate a label radiology print request. This requisition label I will go to the request for IP patient IPD window side. Okay, now the patient will or his relative or nurse will go to the billing desk IPD billing counter and IP billing counter, and here the billing counter will process the service. Before it, the patient should be reflected at nursing desk. So nursing desk will be validate this test for lab test request. They will process the all doctor advice for tests have been reflected here into the nursing desk, and nursing desk will process the lab requisition form. Okay, for lab test, and the radiology part will be performed for radiology test. MRI to be performed, the request will be processed. After this process goes to the billing desk, that nurse have validated the test to be done. So the billing part guys will be make the billing under credit payment, because we will not collect payment from every stage as the patient already paid some part advance at the time of admission. Yes, so we will give this all service under the credit payment. We will billing them, and once the billing have been added, so the lab user, radiology user will able to perform the report and upload in the software patient account. Okay, so the same way IPD laboratory patient will become here. The again bell icon will come. The IP test request have been come here. The same procedure under the laboratory sample collection report preparation will be executed under the IP patient, and sample have been done. Lab report we can mention here. What is the test of the 0.8 or something like that. What is the blood group of patient, and they can change the values of here positive or negative like that. And what is the sugar level of patient. This way the requested test result have been saved. The same way the radiology reports we will be able to mention for the patient, and we go to the radiology part also complete in the system software. So we can use here MRI report format like, and we can write here something. Yes, if we go save test, it will give a printable confirmation with the report or text report value also. That will become printable content with given duty. Yes, once you save the report, if you want to see MRI report without picture, so click on MRI and click on single text report. It will give you the only text report content, not the image will come here. Okay, so that was the radiology part. Now if we go for nursing desk window, nursing desk window will able to see the patient's lab report, radiology report with the bell icon. That are the eye symbol will become. They can see the patient report here also. Similarly, radiology report eye symbol can be seen here with the patient's radiology image for X-ray, CT scan, MRI with image plus text report they want to see. Yeah. Okay. So yes, if they want to print, they click on print icon. The report will be available for printing. For requisition plus report, both can be printed nurse as per their requirement. Okay. Yeah. So it will be interconnected with the department. So that was the nursing desk operational window. Now if we need to do something for patients, medicine part and other things we can do, and here the nurse can able to make the doctor visiting entry, like Dr. Sunil have been visited to patient, so nurse will mention his consultation entry, so the billing side will be added. If the patient we need to shift from like one location, patient is admitted under general male ward, patient requested to go. Yes. This nursing window allow user, like for example the doctor say kindly do the patient's LFT test for this patient. So nurse will select patient lab test, and she can write here LFT also, or whatever test they want to do, they can add their own level, like what test they have to do, like sugar profile or electrolyte test. So they can also order, and that can be processed the lab request for requisition, and that will go to the billing desk. And radiology request can be also performed, like they want to use for CT scan, so they can put order for CT scan, and as well as the USG or something which we want to do ECG, like ECG services, and they can place the order, and this order go to billing desk, and the billing desk user will perform billing completion validation. Once the billing validation have been cleared for the requested 4 item, and after he will save the billing as payment we did not selecting collecting from patient, and the yes, so we when yeah, he will get the service with credit payment mode as the patient is under IPD. They will not pay every time. Okay, only the billing user will validate. Yes, this bill we have to save into the credit payment. Let me show for example. If I do any billing for this patient Edward, if I select 5 tests, let me do RFT test, okay, and KFT test, and something more something vitamin B12 and vitamin B12. 3 tests I have requested for the nurse for this patient, as well as some X-ray services or something we need to advise patient, like X-ray and MRI and USG for example. 3 items we have requested for the same patient, but we do not want to collect a payment as he will pay at the time of discharge. So the billing user will go and select the patient. This 6 item bill will be made under credit payment. So here the mode of payment will be by default due pending. Okay, this due pending means this amount of total bill amount 16,100 will not collected from patient right now, but the service will be added to patient bill account, and I save this account, and I will generate a patient's credit intimation form. Okay, this bill have been added. Now you can see patient have been paid only 20,000. Patient total bill have been updated via 32,500 like that, and now current due is 12,455. If you want to see this rough invoice, so we click on rough invoice button, and the rough invoice will show what is the services and facility given to the patient. Okay, so this is a intimation bill format with the consultation, X-ray under IPD service we give to the patient, what lab test given, and what is the total bill amount, what is the already paid amount to advance, and now current due is available here like this. Okay, after doing so, if we perform lab radiology report as we previously done, the report will be saved by the pathology lab technician and further on so on. And once we want to make the discharge or something, we click on detail invoice. Okay, okay, so for that we need to add some pharmacy medication. Okay, so we go to quickly a pharmacy side, and let me check, do you have created a vendor account or not? So let me check vendor show on. I think no record is there under there. Okay, so let me create a vendor, for example 08 ABC. I put in some vendor GST tax site. And vendor's name like Mediforte Medical. Okay, drug license like MD India right like this way. Contact number extra. Okay, and here yes, so I'm adding the supplier entry plug 25. What is the country code? Sorry, I forgot. Okay, and this is your number, and here the bank detail like bank name like national. This is address is current account, and account holder name is Mediforte Medicals like that. Okay, Medicals Limited. This is the bank account name in which favor we make the payment. Okay, account number like account number of the bank, and here Kenya National Bank. So this is the IFSC or RTGS code. Here mobile number of the vendors which is registered and mail ID. Dr. Sunil will explain. He knows very well what is the it is actually international transaction or SWIFT code like that. Okay, yes, okay, we save the vendor's account for the supplier to making them entry in the software. Okay, so I save this record. Now the same stage we do for a drug master. Let me check, do you have drug master? No medicine. So let me create some medication. For example, we make here general medicine type like composition, paracetamol or something general. Okay, and I put here alcohol 650 mg. Okay, and company name like Cipla. HSN code not mandatory. Packing is the 15 tablet 1 strip. Okay, and it's a 5% taxable. Rate is will not mention here. It is reorder level like 10 medicine and 30 expiry duration intimation. Again we can use here Remitec DSR 250 mg. This is the 30 medicine packing. Tax rate is the 12% for example like this way, and the expiry date of and one this is the syrup. So I put here one is syrup that is called Ascori LS cup syrup. Okay, it is a bottle, so we put here packing 1. Okay, and one product like NS 500 ml, that is the drip. So I put here it's it of type capsule injection, IV set, IV fluid. I put here NS 500 ml. Okay, so Cipla. I put some product for you for understanding better. Okay, the similarly if I put any general product, for example bandage or hotel like bottle capsule dressing injection yes 500 mg. Okay, and this is the way we can put here. The injection packing contain like 10 syringe, 1 injection. Okay, 10 injection. So I put here 5 product in this account. Now let's purchase them from the pharmacy. Pharmacy module. You can go directly from drop down also, and we can make the purchase directly and go to select vendor Mediforte Medicals, and I put here invoice number MM001 like that. And here I can put here alcohol medicine, how much stock we have collected like 500 strips. What is the cost of purchase, like MRP is rate 15 rupees and MRP is 75 patient sale price. And here expiry date like 09/2026. There is a batch code number Along with I use another syrup, ascoril syrup. I put here 250 bottles. Okay, 80 rupees and 150 MRP like this, and this is the 12 2026 and 2027 and this code along with Devtech DSR. It's 700 stock quantity and 60 rupees, 100 rupees price MRP. Here taxable value like 09 2027 and the batch code. So I purchased 3 products. Okay, and this is the purchase tax invoice. A patient we did not make payment to vendor right now, so we are putting as a credit invoice. Okay, and we save this purchase record. Exactly, you can maintain the company wise balance sheet of the vendor purchase history also. Okay, and this moment stock will be added to your central store pharmacy. After that you will available to sell and use the patient side also. Okay, so if we check to the stock quantity show, so we have 3 product stock available in the central pharmacy. Okay, now if we have medication request, so nurse will able to order the medicine request which we have in stock. So we go to select patient in the nursing medical, and we can put what medicine we want to use. For example, Calpol. Okay, that is required for 5 days TDS, so total 15 tablet along with ascoril syrup. I need 1 drop or like that ODS or like that. Okay, so 2 orders for 2 days, and along with Devtech DSR, it is needed for 5 days TDS. So this were 15 tablet order have been placed by nurse from nursing desk to for this patient. So a medicine request order will be generated, and this order request will go to the pharmacy window and the here in the medical sales window. So the medical user will able to select the patient, and the medicine request will be appear here that do you want to indent bill request? Yes. So this medicine automatically come here in the medical window, and the medical user will able to generate a patient credit receipt, and medicine bill will be added to patient bill account into credit payment, and the bill medicine will be reduced from the medical counter, and that will added to patient credit account. Okay, so this is the medicine we have supplied to the patient. Now if we see the nursing desk side, this medicine have been issued to for the patient. So we go nursing desk window again. If we select the patient, and we can check the medicine. So you can see the medicine requested 15 tablet issue from pharmacy, and available current status is already out at this end. Now the nurse can administer that medicine 1-to-1 quantity when they want to use. So if nurse give Calpol 650 medicine to this patient around 11 o'clock, okay, and she give 2 tablet. Okay, so once again I think doses not coming, I need to define doses. So she can administer medicine and consume over the patient step by step. Okay, and the medicine will be used to consume, and will be usable marking entry. Okay, and also automatically will be added once we issue medicine to patient. This medicine will be automatically added to patient account. Sorry, let me resume the session. Are you there, my friend? Sorry. So as we discussed, we was performing the medicines. Uh, Once we do patient medicine issue from pharmacy counter, immediately the same medicine credit payment will be added to patient account also as a billing. Okay. So it will now, if I go to IP billing to show the what is the running bill of patient, we go IP billing window, we select the patient, and all service and billing or you can see in the patient account from OP to IP is available here what service we give. Now if we want to see his detail invoice, we click on detail invoice and we can see what are services day to day we give to the patient from date of admission to date of discharge. So you can see analyze the bill, like this was the medicine bill of the patient first day. It will be changed, the day to day medicine have been issued the patient, laboratory test which we have performed, MRI services, consultation, CT scan, like that all kind of the bill will be available. If along with the bed charges will be also come if we have added to them patient account. Now here the total hospital bill, laboratory advance and bifurcate bill, and here you can see total comprehensive bill come, and here 20,000 advance have been deducted from patient. Now currently payable is 12,969 approximately amount coming here. Okay. Now let me make the discharge or we do something. Okay, if apart from lab or radiology report, do you see once the report have been generated for laboratory, that service will not be available to removable. If only items which we did not perform over patient, that will be available for return. Okay, for example, the X-ray service which we have billing but we did not done to the patient, so we can have option delete icon, and if you click on delete, system will ask do you want to delete. If you click OK, system will ask remark and reason of remark like patient don't wanna take X-ray service. User need to put the remark, and after the service will be removed from patient bill account. Okay, and the amount will be reduced from his billing, and it will be reflected as a red color indicator separately that item was cancelled. Okay. Yes, if any amount is paid, so it will be automatically refund receipt is generating at the time of cancellation, and amount will be disconnected from collection. For example, if you remove any service or cancellation, so refund services, if I want to refund for example X-ray this sonography service. Okay, if I click on this item and system, this is coming refund selected item. Okay, if I click here, do you want to refund the item? If I click OK, yes, patient not required this service as Dr. Sunil advised. Okay, so we can put the remark. After that you can revoke the services if you are admin. If you are not admin, then you cannot remove this. We need to request to administrator. Administrator will approve your service. After that you will revoke the services like this way. Okay, and here is two things. If you delete any item, it will be reflect in the red color of the particular service under the billing. If you refund the item, it will become as a yellow colored separately that item have been refunded, so you can easily identify it. Correct. If I do any additional service, like the billing user want to do like a patient, so operation charges, for example operation services. Okay, see he can add like this way. If he want to make the surgeon charges, so he can add the surgeon charges for patient. Okay, he can change amount also, and he can make the anesthesia charges or various different services. The billing guys will have power to add about the patient services also. Okay, yes, so do you have option to add the patient billing of different part and service which we required here also. So this way we can able to generate patient complete detailed bill, and you can check the bill what is going of the patient services of all kind. And when we want to discharge the patient, we can initiate his discharge procedure also. Okay, so this is his billing bifurcation. Now before we want to discharge bill patient, we want to generate patient's discharge summary. So we go to the discharge ticket. Okay, and here the discharge user will able to select what is laboratory test, radiology services, all data from discharge ticket ICD 10 discharge ticket 10 1010. If I select patient, all record his from admission to discharge automatically populated in this window. If you want to edit the record, and after you can generate the discharge summary like operation notes, surgery services, consumable item entries, what have been consumed quantity, and what is the follow-up date, patient like patient have been recovered, and advised to home rest for next 15 days, and diet as per dietitian. Okay, okay, revisit. Okay, this way the remark and follow-up can be prescribed for discharge summary, and we can generate a discharge documentation for patient with covering all service findings entries from admission to discharge summary. Yes, it can be customized as per our requirement with the headings, content, and pagination design can be changed. Okay. Now after having discharge summary, we will generate a patient discharge bill also, and we go to patient billing window, and we can go to pay final amount. We click on here, it will ask patient amount to be payable like this way, and we can give a discount window here. What is okay, let me go. Okay, if I go to IPD billing window, okay, I selected patient, I will come down, discharge the patient along with the patient bill. When you in our software, until you does not make billing clearance, patient will not be discharged from the software. When you discharge, make the payment, get clearance, the system will be, then patient will be discharged. So billing department have authority to retain patient until payment clearance. Okay, so if the billing user will clear his bill, and he will also generate a gate pass at the time of discharge window. So he will generate 2 gate pass, one for security, one for patient attendant, like that. And he will also collect a pay final amount by clicking red color button. The system will ask a total. Yes, here system asks what amount to be collected from patient. If I click OK, and it is the insurance discount or deductible percent discount. If we bypass them, if you don't want to use, it is the expendable discount, like the nursing charge of overall bill 5% to be applied. So it is will be total bill, so 5% will take. If such charges is not applicable, service discount and final discount. For example, if I want to use 953 983. So this is round off discount we done for the patient. Here the discharge reason, like normal, higher center, referral, expired patient, what was done at the time of discharge, so we can select the reason, and what is the final payment it is paying, payment due, pending, or it will be paid by cash or mobile payment. Like this way we can select the mode of payments. If patient don't pay full amount, so we can have option like we can put here, select here, you can select cash is the he paid 25,000, and he paid UPI for 70,000, and he put some part payment due pending as a non-patient, so we can put his small amount as a due, and we can able to generate patient's discharge bill and receipt, and at this moment patient will be discharged from the software and document will be generated. This is the patient's receipt of 110,000 total bill. Apart from he paid 25 as a cash, 70 as a UPI, 16,000 he have been due, and total paid 95, only 16,000 is pending. This way, and it is his detail. Yes. This is the patient's bill detail of from admission to discharge. It is auto generated along with the receipt. Okay, so at the time of discharge, bill plus receipt are generated software automatically with the bifurcated bill. Correct. Once you discharge the patient, if you want to regenerate the bill, you need to go MIS report section, not in the billing. The patient will be disappeared from the IP billing. After that will be available only finance report department. The finance report department, we go here and we can see the which patient's report we need to check. So we can apply any duration filter, and we can see the consolidated report data. So here you can see the patient Edward is there. If you want to regenerate, it's a patient bill, so you can click on blue icon, patient bill amount. It's a bill, a rough bill will be generated. If you want to see is breakup bill, detailed bill, so it's a detailed breakup bill will be generated from software here in the MIS report side. Okay, so here this way the bill have been available for reprinting after discharging patient. Okay, so this way the IPD flow will be executed. So hope this primary training help you. Kindly repeat this procedure, and I will send you YouTube link of this session. Once I finish, I will upload your video to YouTube for your account private purpose, and you can read out when you have any queries. Okay, and the next step I will plan for pharmacy and other training purpose, so and master data preparation like that. So kindly refer this video how you can repeat that step to memorize. Okay, if anything come under this flow, you can ask me the query, so we can work out in that next session. Okay, so I have advised done this thing. Do you have any specific question right now to answer to you? I am ready for that. What we will do, first of all, kindly collect all master data which we have requested, and we can prepare both mutually, you and me, sitting together. And once we done, then we will line up a training for reception, pathologist, billing department, pharmacy, stage by stage. So it will helpful for you and me also. Okay, and after having some primary idea, I will plan on-site visiting as requested by Dr. Sunil also. Okay. Okay. Yeah. Okay. So you do on you share in on email. I will share you my mail ID where you send me the data which you prepared. Either you want to see me your screen. Okay, yeah. Okay, I will guide you a pharmacy separate session with extended properly. Okay, so that will help you how the pharmacy module works. So we can sit together. Okay. So do you have the Excel format of medicine master data? Okay. Only name, but we need also packing and the company name. I will send you what exactly we are required to pharmacy drug master. So you need to prepare them and then give us. We will upload it from backend side. Okay, I will send you a format for that. Okay. Okay, then. Hmm. Okay, okay. Once you done, you ping me. I will come over any desk or some remote sharing application, and we'll check where it is perfect or something required like that. So if it is okay, we will take it in our software uploading. Okay. Hmm. Let me do that. Okay. Thank you. Okay, so today's session I will finishing this, and we'll see you tomorrow again for next session. Okay. Okay, thank you, my friend. Good day.